Thank you so much. Now, Dr. Hemant, I think 50% of our participants are Ayurveda
Yes,
graduates or postgraduates. That's what I'm given to understand.
yes,
Okay, I think then for them it will be a sort of revision or maybe recap of the things. So please excuse me, and for the benefit of others, I thought I'll bring in we all thought that we should bring in some basics of Ayurveda to the audience to understand the principles on which the uh, you know. Uh, various clinical aspects of Ayurveda medicine is based. So that's how I was trying to make a preface to the presentation, so that the Ayurveda graduates do not feel bored, but I think it would be important for the others to follow those principles. Uh, yeah. So, but without wasting any time, let me proceed forward. Uh, so. This presentation, now I was also listening to certain discussions that were going on, and when Dr. Hemant was presenting about trigunas and tridoshas and so on. Now, these are very abstract concepts, need to be understood, and it is challenging to understand or execute them in clinical practice. That is something which we recently had a paper by Dr. Kishore Patwardhan, who mentioned that what all the basic principles that are there are more in theoretical precepts. To be able to make them into tools and execute them has become or has been a challenge since beginning. Now, let's say, for example, in the yogic parlance, we see that most of the concepts have been, many efforts, more than Ayurveda. The yogic principles have been, efforts have been made to make them into clinical tools, and so that, people can use them. Now, certain things remain in theory, and certain things, when we look at patients, we tend to understand certain things, but sometimes, we get patients with various presentations which defies our understanding of theoretical precepts, and this makes the whole thing challenging, especially for for the students. Let's say, we have thought that vata pitta and kapha behave in this way, and sattva guna, sattva rajas tamas behave in a certain other way. Now, whether these two are related, although the relationships have been said in theories, and whether these have to exist in the way the theoretical precepts are made, need not. All the things that we see can change. Now, when we look at the patients' deha prakriti might be different, and manasika prakriti might be totally different. Need not. I also saw some questions on the chat. If there is a person belonging to a certain prakriti, his mind need not be like that. This is what we see when we see patients. Now, once we started our psychiatric practice, we realized that the presentations can be totally different, and what we approach through tridoshas might not work for the manasika doshas, and whatever might be the presentation of tridoshas, it might be different when manasika doshas are taken in tandem. So a lot of variations exist, and it is the it's not only a challenge but also a holistic understanding of the theories, and then also understand the patient's presentation. And then we have a patient who might be coming with vataja unmada, but then the patient might have a lot of kaphaja symptoms, and these symptoms might be due to acquired or many such factors. It might also be due to the medicines that the patients might be taking, the lifestyle that he might be following, and so on. So it becomes a challenge for us to treat, opposing doshas. The patient is Vataja Unmada, but his symptoms when we see him is Kaphaja. So we treat him for Kapha, Vata gets aggravated, and we treat him for Vata, Kapha gets aggravated. So these kind of things happen when we look at the patient. So the importance here is to see how we can translate the theoretical precepts into tools, find out the results on clinical on the patients, and then interpret them, as per the data. And the data can give us totally different aspects. We also start realizing that we might have to edit or amend the tools that we have. This is something which makes it going. Otherwise, we have been living in the world of theory since quite a long time. So it is time for us, and maybe the students also are craving for such kind of tools, because ability, the science would always justify, or it would be very important that the theoretical precepts are understood in the same way. If there are additions might happen, and these should be, or there should be some kind of opportunity for people to use such clinical tools and then edit or go on them. See, we've been living in the glory of Charaka, Sushruta, and Vagbata since thousands of years. There has to be additions to this. There has to be further progress in the theoretical precepts based on their clinical observations, contemporary understanding, and also understanding of different other theories. So, this is the basis or the principle underlying our pursuit of integrative medicine at NIMHANS when we are looking at patients and treating them. That apart, for the benefit of uh, various uh, professionals from other disciplines, and also for recap of the Ayurvedic group, let me go on quickly on the principles of Ayurveda basic. Now, Ayu has been defined as Sharira, Indriya, Sattva, and Atma. These are four things, and we share common foundational principles with the yogic principles also. Sharira, Indriya, Sattva, and Atma. Sharira is the body, Indriya are the sense organs, Sattva is the mind, and Atma is that which provides a Chetana to all these, or makes the whole organism as one. Now, this is what is about Ayu, and Ayurveda is something that deals with the dynamics of Sharira, Indriya, Sattva, and Atma. Now, doshas, I would like to begin with doshas because this is something which intrigues everyone and starts with doshas and ends with doshas, all the principles that we understand or see. So, this is based on the Brahmanda and Pindandavada. So, Visargadana Vikshepaihi Soma Surya Nilastata Dharayanti Jagadeham Kapavitta Nilastata. Just like the moon, the sun, and the wind are there in the nature, and just like they control the nature, Vata, Pitta, and Kapha control the human body. This is the analogy that has been drawn in understanding of the doshas. Doshas have been divided into those belonging to two substrates. One is the body, and the three doshas are these, doshas which habit the body, and then we have the rajas and tamas, which are the doshas of the mind, and these two have been described separately because of the substrates, or because of the shelters that they inhabit. So now both of them are very closely related also. Each one influences. Now, very important thing that we should be able to understand here is that Rajas and Tamas are the doshas of mind. These cannot be directly influenced by pharmacological agents. These are to be intervened at the level of emotions, at the level of psychotherapies, whereas the doshas, the three doshas generally are influenced or they are amenable for the pharmacological therapies. And through the three doshas, the rajas and tamas are also, indirectly managed. So this is the, something which we need to be aware of when we talk of vata, pitta, and kapha. So these is something which this slide says. So Panchamahabhuta concept, I think most of us are aware of. The Prithvi, Ap, Teja, Vayu, Akasha, these are the five elements. We would look at this concept as a structural basis of everything in the universe. When we have to understand the Tridosha Siddhanta or the Dosha Siddhanta has been described as Pratitantra Siddhanta, which means that it is something which is very specific to Ayurvedic science. It is not there in any other science. Primarily, it has been developed by the Ayurvedic science. It has been adopted by other sciences as well, but then primarily it originates from the science of Ayurveda. And these Pancha Mahabhutas are understood as structural concepts, and the dynamism is understood in terms of Vata, Pitta, and Kapha, or the Doshic concepts. Now, when we understand why this understanding is important, this is the link that connects Panchamahabhutas of various other organisms, living or non-sentient or non-living beings. How do we connect these two? And Panchamahabhuta concept plays a very important role in connecting these two. So when we have the Panchamahabhutas, the five, they go into composition, yeah, of making various other substances. So in the beginning, the Panchamahabhutas have been described as forming the Vata, Pitta, and Kapha. Akasha, Vayu, Vata is composed of Akasha and Vayu, Pitta is composed of Agni and Jala, and Prithvi and Jala is Kapha. So when we understand this, we are able to understand the physiology, which is explained on the basis of Vata, Pitta, and Kapha. The this is the balance that we're talking of. When the Vata, Pitta, and Kapha are in balance, it is health, and when they are in imbalance, it is the disease. So this is what we were talking of. Vata, Pitta, and Kapha as Sharirika doshas, and Rajas and Tamas are the Manasika doshas. So these are connected by the Panchamahabhuta concept. And when all these are in harmony, it is health. And when they are disharmony, it is ill health. It's as simple as that. Now, understanding doshas would be they are the consortium, or they are conglomeration of various gunas. Now, these gunas describe what happens in the human body and how the physiology is understood in the Indian sciences. For example, when the skin is dry, we say then there is a predominance of Vata dosha. And when we feel anything that is burning or hot, it is the Pitta dosha. And when there is something which is more of gravity, then it is the Kapha dosha. So these are the gunas like Laghu, Ruksha, Laghu, Chala, Bahu, Shigra, Shita, Parusha, Vishada. And these are the different qualities which are allied to dry and light. So basically, it is what we experience with wind. Pitta is what we experience with heat or hotness. And Kapha is what we experience with, the coldness, the gravity. So these are the three distinct doshas which are understood by distinct combinations of gunas. And based on these gunas, we understand if there is any change in the physiology or pathology of the human being, of any organism for that matter. And these, under normal circumstances, are now, why do we have to understand the doshas? Is that the very concept of dosha has been derived from the word known as dushyanti. By default, the doshas are set to bring in disturbance. It is the responsibility of the organism to see that these doshas are maintained at normal. Even if the person is not doing anything, the health of the individual can deteriorate or can go into disease states, or there can be disturbances in the physiology also. Left to himself without any interactions also it happens. So the effort of the individual is to see that these doshas are not allowed to go haywire so that his health is maintained. Now, for example, I have given a circle. In the first circle, there is this, spring, summer, monsoon, autumn, winter, late winter, and so on. Each of these, in the season, in the environment, each of these season will have a particular dosha, which or will have factors that influences disturbance of a particular dosha. And it should be the effort of the person to see that he follows the lifestyle which is against the gunas of those doshas. Now, if I have to connect you to the three doshas, their gunas, summer is supposed to be, or summer is lot of heat. Okay. And this heat also brings along with it the vata getting deteriorated. So there is some dryness that sets in. Although in monsoon, in varsha only vata gets aggravated, but then in summer it starts. So when you have this heat coming in, there is a lot of dryness. So oil has to be used. Let's say if there is a condition of the skin which requires moisturizing, then we need to do that. And also summer, we see that there is a lot of heat and the nights are shorter, so the person can sleep in the morning. Otherwise, sleeping in the daytime, during the daytime, has been prohibited by Ayurveda. But in summer it is allowed because the nights are shorter. So it is a charya, or it is a regimen that is done opposite to the quality of that particular season. Similarly, when you see after the winter, the chances, or during winter, the chances, the kapha dosha gets aggravated. And it is the responsibility of the person to see that he does things which are anti-cold so that he doesn't fall ill to diseases of kapha. So this is one such, this I'm just, giving you some overview of how the doshas are constantly on the move to disturb the equilibrium of the human body. This is according to seasons. And when we look at one particular day, the day can be divided into day and night. And during day also, from sunrise to sunset, Vata, Pitta, and Kapha are dominating the environment. And similarly, in the night, after sunset, Vata, Pitta, and Kapha are dominating. It is the second circle. So, for example, let's say in the afternoon, the Pitta is more, and we should be careful enough to see that Pitta Shamana is done. That's how afternoon, the lunch should not be missed. That's because Pitta inside the body is highest during the afternoon, and it can cause diseases, or it can sort of cause disharmony inside the human body. So that's very important in the afternoon. So similarly, you have Vata and Kapha. So regimen which are opposite to that and need to be followed. And when we look at the age, also the Bala children are supposed to be more influenced by kapha. As we go into adulthood, it is the pitta, and as we go into old age, it is the vata. What happens is that because of the pitta, you see the yavanavastha, and during that stage of age, also we see that the human being is full of energy, diseases are less, his ability to achieve things are more, and so on. And as old age sets in, the dryness and these kind of things set in, and we know the various frailty, the causes of frailty of old age, and these are attributed to vata. Similarly, so the circadian rhythms, seasonal rhythms, and age, all these three are constantly working on the human body, causing disharmony in the doshic balance. So this is the environmental influences. Now, how do we plan our lifestyle in terms of what we eat, how we sleep, how we behave with others, how do we take care of the mind and the emotions are all dependent on these cycles, and these should be in such a way that the vagaries of these doshas are controlled. So this is the something which we talk of in terms of doshic changes. Now this is the connect that we generally see. Now we have tridoshas on the left side and rasas on the right side, and panchamahabhutas in the center. Now, the Panchamahabhutas, when we know the different their composition in Tridoshas and in the Rasas, it is very easy for us to connect. Let us say now Prithvi, Jala, Agni, Vayu, Akasha are Panchamahabhutas. We all know it. Vata is composed of Vayu and Akasha. This is something which we know. Now let's say a person, now we have the Shad Rasas or six Rasas. Madhura, Amla, Lavana, Katu, Tikta, and Kashaya. So one very unique concept of Ayurveda is any substance that goes inside the body has been classified based on rasas, which means if you eat anything sweet, you are likely to gain weight. This is a very general principle. If you eat anything that is kashaya, astringent, you are likely to lose weight. This is a general principle. And if you take anything that is sour, you are likely to increase your acidity or increase your pitta. So these are the general principles. Now, Madhura Rasa, when we say, what are the different substances which have Madhura as taste, which has sweet as taste? These can be classified. Now, these can be further classified, but generally speaking, anything that is sweet is more of kapha because it has more of gravity, and that is because it has more of Prithvi. And Prithvi is because, and Prithvi, the characteristic feature is gravity. It is substance, it is substantial. And then it increases Kapha. So when it increases Kapha, what happens? It also, and because Vata is a bit opposite to Kapha, Vata comes down. So the principle to understand would be that if I have, if I am more of gravity, or if I have if I'm overweight, then my food should naturally be not madhura or not much of madhura. If I have acidity or acid peptic disorder, or if I have diseases of pitta, I should be taking opposite of that. I should be taking madhura, or I should be titrating madhura, tikta, and kashaya so that my pitta comes down. If I am more of vata, then I should be taking quantities of qualitative stuff made of madhura and amla. So these are the principles which guide what we eat, the non-sentient things, to the dynamics of dynamics inside the body. Those are regulated by tridoshas. So we have tridoshas inside, and the Panchamahabhutas, which tell us the composition of Tridoshas, and these Panchamahabhutas also will tell us the composition of various rasas, and
Sir,
you classify all the things based on these rasas. What we eat, what we not eat can be based on this principle. So
sir,
this is what,
these rasas, sir, could you explain in English also, sir? What do they mean? Katu.
yeah, Madhura is sweet, Amla is sour, Lavana is salt, Katu is hot and spicy. Tikta is bitter. Kashaya is astringent. So these are the
Thank you.
different tastes. Now, I need not give examples of all that. If you want examples of Kashaya, Kashaya is one of the, if you have eaten amla, now this amla is, most of the people would know what amla is. The amla has all the rasas except lavana. It is said that it is one fruit that has madhura, amla, katu, tikta, and kashaya, all the rasas. And kashaya rasa is something which you can appreciate. If you have eaten jamun, not the gulab jamun, jamun fruit, you might have eaten that black jamun fruit. It has more of kashaya rasa. So there are not many substances which have kashaya, but there are some substances, and these are used when we eat food. And this, sorry, when we cook food, and this has to be part of the, cuisine. Whenever somebody is eating food, all these shadrasas need to get into the body, or should get into the body for the person to be. And this is the concept of balanced diet, which Ayurveda propounds. So now, I put this slide just to, help people develop connect between these two concepts, so that we get usually start getting a lot of questions. Sir, what is most healthy for me, and what is not so healthy for me? Which is the food that I should take, and which is the food I should not take? So that is something. Some people are, the tendency is to develop a lot of acidity, or they take some food, there are a lot of biliousness inside the body. These people should take a lot of bitter substances, so that it does the pitta harana, and also a bit of sweet substances to keep pitta at bay. And similarly for kapha, try and avoid things that can increase their weight. So naturally sweet needs to be avoided, something like that. And for vata, yes, they can take a lot of sweet, and snigdha, or a lot of oily things that should be okay to keep the vata dosha at bay. These are in general principles, but it helps a person to select what he should eat and what he should not eat. Coming to Prakriti, this is a concept that you know is in a lot of discussion around in the domain of health, in health systems also. I would say that Prakriti has been talked about as Swabhava, or something which is there already. It is not acquired. It is the way a particular thing or a substance has been made, and this is the prakriti, what has been described, prakritistu swabhava. Now, what are the determinants? How are they determined? Genetic, when the conception happens. The basically that is the primary determinant of prakriti. It is said that based on the composition or doshic dominance of the of the male reproductive material and the female reproductive material, the a person's constitution is determined, and this, and how he becomes is based on that. So this is Shukra Shonita Prakriti. And then there is Kala Garbhashaya Prakriti. After the formation of the fetus, how is the uterine environment of the mother, and Mathura Ahara Vihara, what is the mother's regimen during the pregnancy, and also the Panchamahabhautik combination is known as Panchamahabhuta Vikara. So these are the determinants of Prakriti. And there are also environmental influences like Jati Prasakta, Kula Prasakta. Now, how Jati Prasakta, Kula Prasakta is these are all influences. So it is said that a person might be born to a race which might be following certain shauchadi acharanam, or certain cultural practices that has implications on health. That is what is Jati Prasakta. And even though a person might be belonging to a certain race, there might be a community that might have adapted to a particular circumstance. So this also determines Okay, fine. So now I was in the concept of Prakriti where uh, am I okay now in terms of voice,
Yes,
Dr.
sir.
Hemant?
Yes, sir. Yes, sir.
Okay, yeah, thank you. So here we are speaking of various Prakriti. Now, to give an example, is Vata is characterized by unpredictability, which means it is moving always. So, and this is, and because of this, and why does it move? It is because of laghutva or lightness. And when there is lightness, there is more of mobility. And when there more of mobility, you also see that associated is shigrata or fastness. So there is rapidity. Now, when these two, and because of mobility and because of mobility also, we have shitata or coldness. And because it is Vayu, it can be encompassing or it can cover a large, a large area in a moment. And it is clear that is Vishada and it is Parusha or it is rough. Now, why these have been told? When these qualities are there, it gets into various characteristic features of the human body. Now, Rukshata, where does it manifest? On the body, on the skin. So the skin is rough, and Rukshata causes the Sharira also to be Alpa, or the body frame is thin. And then it also affects on the sleep. The person has sleep which it is not so deep. Always there is a amount of wakefulness that is seen. Okay, so these, and in swara, when the person speaks also, the swara is broken. This is what is a description. Now, what I'm saying, or what Prakriti says, is about normalcy when you compare it with the others. And because of laghutva, there is laghu gati, laghu cheshta, and laghu ahara. Food that the person takes very light or very less, and then the frequency of food intake is much more. Okay. Similarly, because of fastness, because of shigrata, clinical importance is the person gets a disease very fast, the onset is fast, the course of the illness is also rapid, and the remission also is rapid. Now, this is in contrast to kapha. The onset is slow, the course is slow, and also the remission is also slow. It is not only the diseases of the body, but also diseases of the mind. In the sense that if there is a Vata Prakriti person, he would, get upset very fast because you were a little rude to him or her. But then within the next moment, he will come back to you saying that, oh, it's okay, fine. He's friends again, as if nothing happened. Now, this is what is characteristic feature of Vata Prakriti. Whereas when there is a person who's of Kapha Prakriti, he will not take your words very, strongly until a particular threshold. And after that, he might be upset with you for a very long time. Now, this is the feature of Kapha Prakriti, whereas a Pitta Prakriti might object to your rudeness, but then he is very calculative. He will say that, fine, okay. With respect to this, I was not so happy with you, but then with the purpose of some other pursuit that both of us might be undertaking, let us come to a sort of consensus. So he is very calculative. He knows how much of emotions he should use, in the sense that Vata Prakriti is more expenditure, less of storage. Pitta Prakriti is equal. He tallies expenditure and storage. And Kapha Prakriti is more of storage, less of expenditure. He will always try to find out, use technology to see that physical effort is minimized, and use the technology to get the work done so that he can sit somewhere happily. So this is the kind of differences. Then I have put two photographs. Mahatma Gandhi was typically a Vata Prakriti. If you have seen the way he walked, if you have seen the way he has his behaviors, or his what we call as chesta, and the way he moved, the way he was going, his decisions. I'm not talking of his decisions, but then at least in terms of his physical prakriti, he was a Vata Prakriti. The other photograph I've put is Swamiji, who was in Udupi, one mutt which is known as Pejawar mutt, and he was the pontiff of that mutt for quite a long time. He did four pariyas, and quite active in national stage and in religious platforms also. So most of the people, he just passed away around 3 4 years back. So most of us might be conversant, but when you see him also, you can see the Vata Prakriti, in him. So we have seen both of them do that, and but the other aspect is that Vata Prakriti is known to be very very creative. They are known to be highly talented, with many such talents in them. So they are generally like that. Now in terms of health, let's say in terms of clinical, generally a Vata Prakriti person is known to have alpa bala, alpa ayu, alpa apatya, alpa dana, which means that he resourcefulness is lesser, because he tends to leave things and move on to the next one very soon, and he doesn't make efforts to see that whatever he left behind are connected. So that's how his resources are less. And then it is said that clinically his fertility levels are not so great, and then even his physical strength is not so great. So in this, I'm just talking of Vata Prakriti per se. You generally don't find one particular Prakriti, extreme Prakriti types. You find Vata, Pitta, and Kapha in proportions. But then this Vata Prakriti might be responsible for this Prayena. He says that not, it is not a determinant, but then generally a Vata dominance will have such kind of things where the resources are less, fertility levels are not so good. The bala, the strength is not so good, and ayu is also, lifespan is also lesser than pitta and kapha prakriti. So this is about vata prakriti, and I have put two photographs who, generally when you look in the TV, you tend to identify them with the pitta, with the heat, with ushnata, with the temper, with the clarity in decisions, with the you can very well appreciate them when they speak. When they speak about, we ask them some questions, they get irritated very very easily with uncomfortable questions, and and their decisions are also very lucid, and they take decisions. It might be right or wrong, but they take decisions, and then they tend to defend their decisions. They're vehement, they're very strong, they're very very calculated. 1 + 1 = 2. So, there is no other question. So this is how even their body behaves. Um so it is because of Ushnata, Tikshnata. Now, because of this Tikshnata, they have this Parakrama, they have Agni. And one thing clinically we see is they have this tendency to eat more frequently, because they cannot tolerate hunger. They sweat a lot. They cannot tolerate hunger. They get irritated. You can see that they become irritable if they are hungry. So this is one, conspicuous thing that we can see. Their hairs are sort of reddish and so on. And the clinically, when we look at their diseases, onset, course and remission of diseases are also faster than Kapha Prakriti, not as unpredictable as Vata Prakriti, but then it is sort of medium. So this is what determines the Pitta Prakriti, and here is the Kapha Prakriti, wherein you see that there is a lot of, you feel as if there is a lot of time. When you talk to Pitta Prakriti, you feel that you should be on toes. And in Vata Prakriti, after the end of the conversation, you don't know what to do because you have not understood what actually you should be doing. Whereas Kapha Prakriti, you start feeling so calm, so composed. If you have seen Atal Bihari Vajpayee speak, you would know that it is he would take his own time to deliver, but then his speeches. But then we would also know how effective that speech was. Although it was very slow, it would take its own time, but then it would be very, very effective, and it wouldn't have anything that is penetrating. It would be very soft. It would not offend anyone. It would take everyone together. So consensus building is one of their very important talent. So that is the importance of Kapha Prakriti. Onset, course, and remission of diseases, it takes a long time. They don't get affected by diseases quite frequently, but when they get affected, they actually go down very strong. So it's like they say, it's like a people tree falling down. So it takes a time for them to get up and on their to be back on their toes. It takes a lot of time. Otherwise, basically they're characterized by slowness, density, gravity, and so on. So this is the quality of Kapha Prakriti. Now, how I forgot to tell the other clinical importance is their fertility levels are very high. They're extremely resourceful because they would have kept all their gains together. They have this tendency to store. They have this tendency to connect with everyone and keep them together. And they take a lot of effort to do that. So that's how we see it is said that Balavanto, Vasumanta, Vidyavanta, Ojasvina, Shanta, and Ayushmanta. Balavanto, they're very strong. Vasumanta is they have many children, is what Charaka says. And then Vidyavanta, they never stop gaining or acquiring degrees. They keep on reading, they keep on doing many courses. Ojasvina, they have a lot of energy. Shanta, they are always peaceful. And Ayushmanta, they have long life. So these are their qualities. So which has a lot to do with the way uh, their built is, and how their immunity or health is determined by these doshas. So general principles are: Vata Prakriti need to be nourished and restrained. Pitta Prakriti needs calculated advice on food and behavior. Kapha Prakriti needs depletion and motivation, which means Vata Prakriti is always on the move, so he needs to be restrained. Please, please, aap thoda shant ho jao. Whereas a Kapha Prakriti is always sitting. No, you need to make him move. Get up, get up, get up. What I'm saying is a sort of personification, but then the same thing is applicable even to the physiological processes. He need to be chalo utho on the double. So this is the principle that guides the three doshas. Now this is about Prakriti, and then when we look at the other aspects of physiology, Dhatu, Srotas, and Mala, these doshas in the body, what we understood, till now we have seen about the natural, how they behave in the natural way. What we need to always understand is doshas are by default, their tendency is to cause disturbance. Now, doshas are existing in normalcy and also in abnormalcy. We generally tend to get confused between normalcy and abnormalcy. We have what we call as Prakriti and Vikriti. What is there in Prakriti will always remain to be there in Prakriti. It doesn't change. Whereas Vikriti changes. So, which means how Prakriti determines this is, if a person already or sort of has a dominance of a certain dosha, and if he gets a disease of that particular dosha, then the disease tends to become severe, which means if a Vata Prakriti person gets Vataja Unmada, Unmada is psychosis or schizophrenia. So when such things happen, the severity of the disease might be more. So the pre-morbid Prakriti is very important for us to know to plan the treatment. So that is something which Prakriti helps us, and also plan what medicines to give, and what are the treatment plans that we should make. So that's how these prakritis need to be or doshas need to be understood. So mainly understood under normalcy and also in abnormalcy or in disease conditions. Now, how these dynamics happen? Now, when the disease is to be or is being developed, or there is some causative factor and based on which the disease is coming up, it tends, these doshas tend to go and settle in the dhatus. And the dhatus have been divided into seven: rasa, rakta, mamsa, asti, majja, and shukra. Rasa is the watery or the liquid tissue of the body. Rakta is the blood. Mamsa is muscle. Meda is adipose. Asti is bones. Majja is bone marrow, and then Shukra is the reproductive material. So these are the seven dhatus. Now the doshas, now all these dhatus are present and they are healthy. This is what is normalcy. Now, because of some reason, it might be genetic or it might be traumatic, or two of these dhatus might develop something known as vulnerability. And when there is vulnerabilities, these doshas go and start the disease process. Generally, rasa, mamsa, meda, majja, and shukra, these five dhatus are affected by kapha. Asti is affected by vayu, and rakta is affected by pitta. So this is how these doshas govern the functioning of these dhatus, and the same things are known as dushyas because they are getting affected by the doshas. So that is how the dhatus have been described. And anyway, we have the malas, which are mutra, sweda and purisha, and the srotasas. Now these are some of the concepts. Now, the srotas is a term that describes the systems or channels. So these are the systems where this particular functions can be seen, or these functions happen. Now, pranavaha srotas is nothing but the respiratory or the airway of the body. Udakavaha srotas, srotas means a system or a channel. Udakavaha srotas is the liquid, compartments of the body. Annamaha srotas is from the time you take anna to how, final assimilation, it is the annavaha srotas. So similarly, all the other srotas are described. So these include all the structures as well as functions of that particular dhatu, or that particular important element which helps to sustain the life. So these are srotasas. So we have known the doshas now, and how these doshas affect the dhatus, and which are the malas which finally get affected under normalcy and also under disease conditions, and which are the malas: mutra, sweda, and purisha. Mutra is the nitrogenous waste, sweda is the sweat, and purisha is the feces or the fecal matter. And then we also see the functions of these dhatus under the terminology of srotas. So when we talk of or describe a particular disease, we would have to say all these. There is a particular dosha. For example, if the person has a chronic obstructive pulmonary disease or asthma, then there is, because it might be due to an obstructive cause. So because of kapha, there is obstruction to the movement of vata in the pranavaha srotas. Okay, because of kapha, there is obstruction to the movement of vata in the pranavaha srotas. This is how affecting the dhatus, rasa mainly, and then later it can affect the other dhatus also. Let us say if he is a chronic asthmatic, then he might become cachexic, his nutrition levels might go down, then mamsa also gets affected. And if mamsa is affected, when mamsa is affected, before that the adipose, the fat tissue also gets affected. So these are how, as the disease progresses, the dhatus also getting affected, and those particular systems also get affected. So you have the pranamaha srotas getting affected, and because of which the other dhatus also might be getting affected. The doshas are kapha and vata. So mainly it is the vata. So when the obstruction is removed, what happens? The prana starts moving in the normal direction. So this is what we generally explain. It's just a general example to talk about what happens in diabetes. There is medas that gets affected, and because of medas, starting how the kapha starts getting, what happens is there is a vulnerability, and this vulnerability can be genetic or due to mityahara vihara. Kapha gets lodged in the medas and starts disturbing the medas, and from there the all other dhatus also get affected. These dhatus finally go away from the basti as mutra, and as the dhatus are getting lost, the person becomes thin and thin. So this is what, Madhumeha is one such disease where all the dhatus are affected. All the the sapta dhatus are, affected over a period of time. So some examples of how these play or important role or are just assessed is, some was the aim of this slide. So then we come to Agni. Now here, Agni has been divided into Jataragni, Bhutagni, and Dhatwagni. Jataragni is the Agni of the digestion. This determines the other Agnis, the Bhutagnis and the Dhatwagni. So if the Jataragni is disturbed, the Bhutagni and Dhatwagni also gets disturbed. Bhutagnis means all the Agnis that convert are responsible for conversion of raw material into various bhutas, that is Prithvi, Ap, Teja, Vayu, and Akasha. Similarly, dhatus are Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra, seven dhatus. So conversion of raw material into these, the replenishment of these dhatus happen by the help of dhatu agnis. Now, which is the Agni that controls all of these is the Jatra Agni, which is the digestion. Jathara means, the duodenal part or the gastrointestinal tract where the digestion, the lower part of the stomach and the duodenum. So this is the area which is known as Jathara. And Agni, which is present there, determines the other Agnis also. So when you look at modern descriptions of digestion and metabolism, also whatever food we take, and this food getting digested, being broken down into smaller parts and various other proteins, goes and replenishes all the different other tissues of the body and is responsible for the maintenance of life. So similarly, Agni has been described. Now, what happens in disease condition is that when an Agni is disturbed, that particular conversion doesn't happen fully, and there are metabolic end products leading to a particular disease. And the effect is also that the particular dhatu doesn't get formed properly and starts developing vulnerability in that particular dhatu. Let's say you've been eating only fat, or if there has been only conversion of food only into fat, then what happens is development of uh, adipose more or medho dhatu more. That is why we see that the patient who is obese or morbidly obese has lot of fat, but then suffers from anemia because there is no replenishment of the blood or rakta dhatu. But there is all the tissue elements are getting converted into fat. So this is the defective Agni. And here is the ama that is causing all this, and then the treatment is also accordingly planned. So this is the concept of Agni in general. Then we have the different other Dashavidha Pariksha Bhavas, which have been considered as important in assessment of an individual. So starting with Prakriti, we have already seen Vikriti, is assessed in terms of the causative factors, the doshas, the dushyas, Prakriti, Desha, Kala, Bala, and Linga. Now, Nidana are the causative factors. Dosha is what we already saw. Dushyas are all the Saptadhatus. Prakriti we already saw. Desha is the place where he belongs. Kala is the time, and then Bala is the strength, and Linga are the symptoms. So this is the assessment for planning the treatment. Let's say if a person has been taking a lot of sweet Madhurahara, that becomes the Nidana. Madhurahara leads to disturbance of Kapha. This is the dosha which is involved. What happens when the person is has been taking a lot of sweet for a long time? The dosha Medas gets affected. That is the Dushya. Kapha has increased, Dushya Medas got affected. Now, if the person belongs to Kapha Prakriti, let us say, for example, let us assume that he belongs to a Kapha Prakriti, and a Kapha Prakriti, the tendency of Kapha is more. His Kapha is increased because he's always been taking sweet, and because his Kapha is increased, and because he's been taking sweet always, his Medas is, has got disturbed. And Desha, how it matters is Desha has been divided into Jangala, Anupa, and Sadhara, which means Desha where based on the environment there, Kapha is more. Like for example, coastal areas. Coastal areas, Kapha is more. Arid areas like, desert regions and so on, the Vata is more. Okay. So let's say the patient belongs to a area where there is lot of Adana or coastal areas where there is lot of water. So here it is the Desha, which also is favorable to Kapha. And Kala, we have seen that winter there is, Kapha Vardhana. So that is the Kala. And Bala, let us say Bala in Bala, Vruddha, and Madhya. So let's say that the person is sort of Vruddha. So what I am trying to say is all these factors are so interconnected, the disease becomes very severe. He develops, I said Kapha, I said Medas, he develops diabetes or Madhumeha or Prameha, which can be severe. And this is how it is determined. So, which means I will have to use treatment which opposes all these. If, for example, the patient has all favorable factors, but he is a native of Rajasthan, which is very arid, and there for me it might be easier for me to use medicines that to treat him. So like that. So these factors helps the physician to have to determine the severity of the disease and also to use the right kind of treatment. Sara is excellence of tissues. If all the tissue elements in his body are excellent or well formed, then he is known as for each dhatus, there are different lakshanas. Samhanana is compact, how compact and proportionate the person's body is. Pramana are various measurements, whether he is appropriate for his age. Sattva is the mind. Pravara, Madhyama, and Avara Sattva has been described. Now, there are various ways of assessing. It is very simple. A Pravara person he is highly resilient. He doesn't need anyone's support. Madhyama Sattva needs somebody to give him reassurance, and Avara Sattva is very difficult to manage. He will run away. He will say no, no, no. He will panic. So these are the differences. Accordingly, they need to be managed. And Satmya is adaptability to various food and also habitat environment. It can be, a person might be able to eat everything he and then digest them, and also his ability to live in various. He might live in a coastal area, he might live in an arid region or any such place, and he might get adapted, and that determines how a person's ability to combat the disease. And Ahara Shakti is obviously the digestion, and Vyayama Shakti is the how is physical endurance and also via. So these are the factors that determine the treatment process and the planning of the treatment. Diseases have been classified as Adhyatmika, Adi Bhautika, and Adi Daivika. Adhyatmika diseases are diseases, when you look at these classification, very comprehensive classification, all the diseases that have been described, even by the modern, science, medical science has been described. Adi Bala Pravritta is due to the Matrija and Pitrija. Genetic causes. Janma Bala is due to the Mathura Ahara Vihara, the perinatal insults. And then Dosha Bala is due to Mithya Ahara Vihara, which is violation of healthy lifestyle. So these are the this is something which is nimitta to that particular person, or Adhyatmika. Adi Bhautika has been divided into Sanghata Bala. It might be traumatic experiences. It might be due to any Shastra or Vyala accidents and so on. Adi Daivika have been divided into Kala Bala, Daiva Bala, and the Swabhava Bala. Now, Kala Bala is due to Ritu Swabhava because of the seasons. Daiva Bala is due to natural disasters. And then Swabhava Bala is even the natural kshut, the hunger, the thirst, the old age have been considered as diseases, but these are Swabhava Bala Pravruta. So these are the various classification of diseases have been described. And then the treatment have been described as Daiva Vipashraya, Yukti Vipashraya, and Sattva Avajaya. Now, Daiva Vipashraya are the spiritual therapies. Yukti Vipashraya have been divided into two. I'll just give you a small, input as to what Yukti Vipashraya means. Now, Yukti Vipashraya is use of pharmacological agents. Okay, the last slide. So this Daiva Vipashraya, Yukti Vipashraya, and Sattva Vajaya. So wherein we use Samshodhana is something which we use for cleansing therapies, and Samshamana for pharmacological therapies, and Sattva Vajaya is the term used for psychotherapies. So these are the basic principles of Chikitsa. So there I just introduced the terminologies and principles of basic principles of Ayurveda in terms of how we look at how normalcy is perceived, and what is the understanding of how a person gets a disease, and what are the treatment principles of treatment that are used in the Ayurveda. And based on these perspectives, most of the um, um, theories are based, and most of the descriptions are based. So these none of these aspects are or most of these aspects are abstract. It is left to the physician to understand and document his experiences by using those particular principles in assessment, evaluation, as well as in treatment. So this is where I think I should end my speech. I think I can take some questions if there are any.